The brain is a remarkable organ, constantly balancing its metabolic needs with blood flow to maintain optimal function. This process, known as flow-metabolism coupling, becomes particularly crucial during anesthesia. Flow-metabolism coupling is the brain's ability to regulate its blood flow based on metabolic needs. Despite only being 2% of our body weight, the brain consumes nearly 20% of our oxygen because it is constantly active, demanding a steady supply of oxygen and nutrients. When neurons increase their activity, they release byproducts like adenosine, nitric oxide, and potassium ions. These chemicals cause nearby blood vessels to dilate, increasing blood flow precisely where it's needed.
Next, we're diving into how the brain cleverly manages its blood supply to keep up with its energy needs, especially important during anesthesia. Let's start with cerebral autoregulation. Imagine your brain as a smart traffic system. Even when the pressure in your blood vessels changes, like during surgery, your brain adjusts. It tightens or loosens blood vessels to keep the traffic, or in this case, blood flow, moving smoothly. This helps maintain a constant flow of blood no matter what happens with your blood pressure. Crucial during anesthesia, right? But that's not all. The brain also has a local delivery service. This is called local blood flow coupling. When certain neurons start firing more, like a neighborhood getting busier, your brain sends extra resources, oxygen, and nutrients right to that spot. Neurons release signals like adenosine and nitric oxide, which act like a special delivery request for more blood. In short, while cerebral autoregulation keeps overall blood flow stable, local blood flow coupling ensures that active brain areas get what they need exactly when they need it. That's the brilliance of our brain's regulation system. During anesthesia, several factors regulate the brain's blood flow and metabolism, ensuring the brain gets the oxygen and nutrients it needs. Let's start with anesthetic agents. They're like drivers on a highway. Some are reckless, like isoflurane and desflurane. They speed up blood flow, increase cerebral blood flow or CBF, even when there's no extra energy demand from the brain, a phenomenon called uncoupling. This can lead to an unnecessary increase in blood flow, even when the brain's metabolic needs aren't high. On the other hand, agents like propofol are the careful drivers. They maintain a close match between the brain's energy demands and blood supply, ensuring the brain doesn't get flooded with extra blood it doesn't need. Next up is carbon dioxide, PaCO2, which acts like a traffic light for blood flow. When CO2 levels rise, causing hypercapnia, it's like a green light for blood vessels to open up, allowing more blood to flow to the brain. But when CO2 levels drop, leading to hypocapnia, it's a red light, blood vessels constrict, and the flow slows down. This balance, known as normocapnia, is crucial during anesthesia to ensure steady blood flow. Now think of oxygen, PaO2, as the brain's fuel. When oxygen levels drop, called hypoxia, the brain sounds the alarm and blood vessels widen to increase oxygen delivery. But prolonged low oxygen can cause severe brain damage, so maintaining adequate oxygen levels during anesthesia is like making sure the car never runs out of gas. Lastly, blood pressure is like controlling the flow of water through a hose. If the pressure is too high, it can damage the blood vessels, the hose could burst, and if it's too low, not enough blood reaches the brain. Anesthesiologists need to carefully manage blood pressure, especially in patients with conditions like hypertension or stroke, where the brain's ability to auto-regulate blood flow may be impaired. Managing these factors, anesthetic agents, CO2, oxygen, and blood pressure helps keep the brain's blood flow in balance during surgery, ensuring its protection and health. Let's break it down into 4 pieces for easy understanding. 1. Choosing the right anesthetic. Think of anesthetics like different types of cars, each with their own style of driving. Some, like propofol, are smooth drivers. They keep the brain's blood flow and energy needs perfectly in sync. This balance is especially useful for high-risk patients as it prevents the brain from getting more blood flow than it actually needs, avoiding potential complications. 2. Monitoring brain blood flow during surgery. Anesthesiologists use real-time tools like near-infrared spectroscopy and transcranial Doppler that act as a GPS for the brain, tracking blood flow and oxygen levels. This helps spot any traffic jams, flow disruptions right away, allowing quick adjustments to keep blood flow smooth and steady. 3. Managing high-risk patients. Patients with cerebrovascular conditions or those undergoing brain surgery need extra care, like tailoring a suit to fit just right. For these patients, specific anesthetics and detailed monitoring keep blood flow and energy needs balanced, providing the brain with just the right support during surgery. 4. Avoiding postoperative brain issues. Keeping brain blood flow and metabolism in sync is key to preventing complications like cognitive issues, POCD, or even stroke after surgery. Anesthesia is not just about putting someone to sleep, it's about finding that sweet spot to protect brain health and support recovery post-surgery. With each step, anesthesiologists are carefully managing anesthesia to keep the brain balanced, safe, and functioning well.
That's the brilliance of our brain's regulation system. For more detailed content, check out optimalanesthesia.com. Stay tuned.